The leaves change color, the air gets cold, and the jackets come out of storage. And with autumn's return, flu season is right behind. Experts warn the flu season could be a bad one after Australia had its worst influenza outbreak in half a decade. Dr. Julie Morita joins me now. She's the executive vice president of the Robert Wood Johnson Foundation and a member of the CDC Advisory Committee to the director. So, Julia, if it's bad in Australia, does that necessarily mean it's going to be bad for us?
Hi, John. Thanks for having me tonight. Yeah, I think the key thing to keep in mind is that with every influenza season, we typically monitor what's happening in the southern hemisphere the season ahead, just so that we can get a sense of what we might anticipate. And what was seen or has been seen in Australia is a longer season that has impacted younger children more dramatically than we've seen recently. So it's really a good opportunity to wake everybody up in the United States to think about getting their vaccinations and getting them now. It's not too late, and people should definitely go out, children included, to get their vaccines as well as their COVID vaccines.
And Julie, you were for, I think, a couple of decades in the public health system of Chicago. In terms of uptake of the flu vaccine, what are some of the impediments, and what are the impediments that you saw during the course of your career there, but also then now in the wake of COVID and the experience we've had with 2.5 years and debates about vaccines and the rest of it?
Yeah, John, so I was the health commissioner for 4 years in the city of Chicago, but prior to that, I was responsible for the immunization program in the city of Chicago. And we had influenza vaccination campaigns every year because it is a serious disease and it can be prevented by getting vaccines out to the community. Barriers that we saw were numerous. People weren't aware of the vaccines, didn't know how serious the disease could be, but there were also problems in getting access to the vaccine. It wasn't always readily available, particularly in some of our poorer communities or our communities of color. So the health department really prioritized getting vaccines into those communities and also working with community organizations to help them understand the need and the benefits for the vaccine. What we saw with COVID vaccine was something similar in terms of poor uptake in the beginning by our poor or in low-income communities as well as our communities of color. But what happened in the response was there was a lot of resources made available through the federal government to state and local governments. So there was a lot more attention being paid to the vaccinations, a lot more resources going to community to make sure people had access to the vaccines. They were scheduled after hours, on weekends. There were transportation supports. So people really didn't have the barriers that we've had in the past related to influenza vaccines.
And this one in particular, I think this is the first time adults over 65 are being asked to get a high dose of this vaccine. Why is that?
So there has, over the past few years, maybe 5 to 10 years, there's been a high dose, stronger vaccine available for people over 65 years of age. As you age, your immune system just doesn't respond as well to vaccines. And so it's important, what these vaccines do is they increase the amount of the vaccine so that people will have a stronger response when they're older. There's also sometimes other ingredients called adjuvants that are added to help increase the immune response as well. But all those things are available for people who are 65 years of age and older. And so when they go to get their vaccines, they should ask for the senior citizen version of the vaccine or the stronger doses of vaccine when they go to get their vaccinations.
All right, Dr. Julie Morita, thank you so much for being with us.
Thank you. Thanks for having me.